My name is Suz Mondello. I am raised in the Midwest. I have lived literally all over the country in different parts of the world, been blessed with that. In my early 50s, I was diagnosed with endometrial cancer, and I went in for a routine checkup, my yearly checkup, and my doctor said, I think I want to do a little additional study. And we made an appointment for that. And then the study was supposed to take like a half an hour. And after about 10 minutes, she was finished. And she said, I saw something odd. Let me send this to the lab and I'll give you a call back. Well, the next day, it was a cold winter day. It was January. And it was about 4:30 in the afternoon. I remember it because the sun had just started to set and none of the lights were fully on in the house. And my gynecologist called and said, "Hey, do you have a moment?" And I said, "Yes." And she said, "Are you alone?" And I said, "Yeah." And she goes, "I'm so sorry to have to tell you this, but the test came back and you have cancer." And while I was very grateful to learn quickly, it was also pretty horrifying to hear those words and be alone. I've heard horror stories of people reading in their charts that they had cancer. I've heard stories of people, doctor calling them into the office and they were with their spouse or their family member and being told. So I think each of us are told differently. I wish there was a kind of a standard way of learning that you've been diagnosed. But it seems to be all over the board. My journey went very rapidly. My gynecologist was a female, and she said, "I want to start introducing you to a couple experts, and then I want you to make some decisions because I think you're going to need to have surgery." And so we settled on someone. I met with that doctor, and then she's called a gynecological oncologist, surge gyno, because she also does the surgery. So the gynecological oncologist, and you'll start learning all these terminologies around the type of cancer you have. And so she said I need a hysterectomy. So I ended up 2 weeks later having a hysterectomy, and I'd never been in the hospital. As much as I'd wanted to have children, I'd never had children. So I'd never been in the hospital for any reason. And parts of that went smoothly and parts of it didn't. They kind of missed when they put my epidural in. And I just remember tears streaming down my eyes. And it was very foreign to me because, as I said, I had never spent any time in a hospital. And the surgery was pretty brutal. It was about 7 or 8 hours. And they only allow 1 hour, one night for you to be in the hospital after that type of major surgery. And when I came out, I was in shell shock. I really did not even understand what happened to me. It happened so fast. And I really didn't even have a chance to think through, should I have done surgery right away? Should I have waited? There was so much dire messaging put around it. I just kind of looked to the doctor and followed everything that she said I ought to do. And I entrusted everything to her. And after going through that is when I started discerning more, is this the right thing for me? Is this the right choice for me? And I didn't even know I could ask those questions. And I was fortunate that I had spent a lot of time in healthcare and the pharmaceutical industry, in the biotech industry. I'd worked in management consulting as in the healthcare industry. So I understood diagnosis, prognosis, protocols, studies. And that was really important because once I started reading about my diagnosis and the studies, I started realizing there are many paths. And so one thing I would recommend is when someone's initially diagnosed not in all situations, but I'd say in probably 80 to 90% of them, take a step back and breathe and do a little bit of homework before you launch into what your decision is going to be. I also made an assumption that it would be integrative. I'm not sure why I thought that, but I had become even though I spent a good portion of my career in corporate America, I had, I guess that would have been 6 years before, had become a certified nutritionist. And so I just thought food would be a part of this. And I thought movement would be a part of this because I was also very athletic. And I just thought they'd treat the whole person. Because when I started reading about cancer, I saw that, again, I was the first person in my family ever to be diagnosed with cancer. And so this was all very foreign to me. And I just assumed we'd take care of the mind, body, spirit, nutrition. I just thought all of that would be part of it. Whoa. And I was at a major top 10 institutions in the United States. And much of that was not even explored or discussed or assumed. And I don't recall how I got connected. I think Laura may have been one of the first people who then connected me to Commonweal and Michael Lerner. And I devoured, at the time it was BCCT, Beyond Cancer Therapies. So BCCT, I forgot the fourth word. And I just started devouring it. And I was fascinated by how cancer was managed in different parts of the world, not just in the different parts of the country, and different types of cancer. Or people think you have cancer and they'll start telling you, well, my dad had prostate, and they just assume all cancers are the same, even though it's a female and a male part. Or, oh, I heard of this great research that's found a cure for lung cancer. And they just assume because there's a cure for lung cancer, it'll cure breast and any other kind of cancer. So there's a lot of misinformation in how we discuss cancer, and what is a diagnosis? What is a prognosis? What does the staging mean? I was so woefully incorrect in what I understood in all of that. I was diagnosed with the stage 3C. And then I learned there's so many other terms to be looking out for. And then that's when I learned, well, what's your prognosis? Well, what do you mean, what's your prognosis? Well, how long are you likely to live? And that also kind of ticked me off, because I didn't feel like, well, I'm an individual. I'm not a statistic. I'm going to live a normal, long life. And I do think part of what has kept me alive I'm on my 4th year of cancer survival, diagnosis, I don't know what you want to call it. I always looked at the cancer more like a really bad flu or pneumonia that I just had to overcome. I didn't see it as something that was taking over my body. My brain could not comprehend that. And so I always treated it like it was something I could overcome. So it was just a matter of finding the right treatment for me. So once I started looking at integrative and doing more of the studies, and I believe we're going to dedicate some time on how to research, because I think there's a tremendous amount of misinformation out there. There are some fabulous sites that we can make sure that we go through and share based on your type of cancer. Usually there's a branch of the Cancer Society that is dedicated to your type of cancer or an individual's type of cancer, whether it be breast, esophageal, lymphoma, you name it. There are specific resources dedicated, but then there are also organizations that are dedicated. Then there's also what we'll call, not to mean anything badly against Google, but Dr. Google, people will start researching and just go down rabbit holes and be mortified or have really bad information. And so I really encourage people to vet. And by vetting, I mean really understand your source. What year was it? Who was it? Who was the author, or what was it written by? Is it a study? Is it just, there's so many variables that I know. CancerChoices, another incredible resource that will help you vet through all of that. So I was pretty much told that my options were chemo and radiation. And as I had mentioned, I think one thing that has saved me throughout the years is how athletic I was. I was very active. And so I had been living in the Northwest and had moved back to the Midwest, but I had been hiking anywhere from 2 to 4 days a week. I had been swimming 2 days or more a week, cycling 2 days or more a week. So I was very strong. And I know that helped me. So I just assumed I would keep doing those things.
Suz, I want to interrupt for a second.
Sure. Yeah.
And you said your options were chemo and radiation. So this is after your surgery. Then you had
Yes.
options. And was it to do either or was both of them on the table, or how did that work?
It was pretty much assumed that I would start with chemo and then I would do radiation. And because of my ability to research protocols and guidelines and studies, I started reading and realizing almost at the exact time I was diagnosed, a study came out in the New England Journal of Medicine, and again, very reputable journal, that patients didn't, with endometrial cancer in stage 3 and 4, lives were not prolonged with chemo and or radiation, definitely not with radiation. And in some instances, well, in many instances, their quality of life was diminished rapidly. And that was something else I didn't understand till further on, what it meant to consider quality of life, which became my mantra and guiding light. For me, I would rather have quality over quantity. And part of that was because of people I had witnessed who were cancer patients. And there's this trajectory that I had grown up with that it was assumed you'd kind of follow. You do some type of chemo, you do some type of radiation, and then your body would just deteriorate, and you'd go from men who would be 200 pounds would go down to 125 pounds, and women who are 130 or 150 pounds would go down to 80 pounds. And it was just part of the process. It was just accepted that you would go onto these drugs and these treatment protocols that would cause neuropathy, which is, the loss of sense of your fingers and toes, or the end organs in your body, or that you would have a difficult time urinating, or that you'd have difficult time having a bowel movement, or that you would losing your hair was a big fear, but that became a piece of cake compared to everything else. The rashes, my organs shutting down. So it was assumed that I would, yes, go into chemo and then radiation. And after the chemo was in and of itself horrific for me, because I weighed about maybe 114 pounds. And they were giving me the same dose as women who were 2 and 3 times my weight, because I also didn't fit the profile for endometrial cancer. Most of the women are in their 60s, 70s, overweight or obese, childbearing, or have had children, probably had diabetes, and I fit none of the profile. And so they were giving me the same protocols as they were giving me these women. And I'm thinking, why are you giving me that much drug? You are literally killing me. And in many instances, they were. My immune system, my white blood cells were one of the, you'll start to learn all the indicators that you measure for specifically for your type of cancer. Mine was called a CA-125. There are different cancer markers based on your type of cancer. And you may or may not, those are kind of benchmarks. You may or may not fall within those, and they may or may not be accurate in determining where your disease is. Ironically for me, my CA-125 wasn't really a good indicator, because I hovered around the teens, and most people were in their 30s, 40s, and above that showed this type of cancer, but it wasn't a great marker for me. So I learned to rely more on my blood tests and other markers. And one of them was my white blood cells. And every time we put me on a white blood cell, the chemo, my white blood cells would put me into the range where they would have to give me a drug called Neulasta, which would help rebuild my white blood cells, but also put a lot of the other organs of my body at risk. So we don't often have to test my kidney, my liver, my heart, my brain from time to time because of fluid on the brain. So yeah, it was assumed that I would go on to radiation. And after doing some of the research, I remember the first time I went to a radiologist, I showed him the article, and he said, "That's such an awful article." And I'm like, "Why is that an awful article?" And he said, "Well, it shows that you shouldn't have radiation. Radiation's really good." And I'm thinking, it's good for whom? You giving the radiation, or me receiving the radiation and all the hazards that are going to happen to my body? And we could never come to agreement on what a poor study meant, because we had diabolically different viewpoints and perspectives on him wanting to diagnose, to administer the immediate radiation and me having to receive it. So I think what I started learning then is the person across from me, what is their motivation in treating my disease state? And is that in alignment with my own? And how do I even know that? I didn't even know. I didn't even know to ask those questions. I didn't even know that I needed to be concerned about those things. And I remember fighting and fighting to lower my meds, and they wouldn't lower my meds, even though I kept losing weight, and I was emaciated, and my organs were starting to really take a hit. And the way they could identify that was through the blood test that they would do. So I made it through the 6 rounds, and it was assumed that I'd take up. They wanted to start me on. Actually, they wanted to start me in the middle of it. I'm thinking, I can't eat. I've got sores in my mouth. I've got rashes all over my body. I can't do radiation and go below 100 pounds and do chemo. And so we waited, and then I took a little hiatus. Then I met with the radiologist. I said, I personally could not do that to my body. I just could not have something irradiate into me. I just, whether I love myself all my whole life or not, I just could not physically see myself doing that to myself. So I turned it down. And I actually 3 times in my lifetime with cancer, I've turned down radiation. Finding a partner in your health is really essential, and more than one. I build my team, and my team can shift in and out. Sometimes I needed PT, and I'd have a PT practitioner. Sometimes I've always had the acupuncturist. I don't do the yoga like I used to, and that's okay. It was for its time. I don't walk as far as I used to, and that's okay. It was for its time. But we are ultimately in charge of our lives. Yes, I believe in there's a divine plan, but that's just my belief system. And I believe in certain things, like it's important to be kind to myself and kind to others. But I think it's okay to be angry. And sometimes when I would get a diagnosis, I couldn't talk to anybody for 3 days after a CT scan or a PET scan. And I was angry. I was mad. And I let myself be all those things. I let myself be, excuse my language, ticked off. I would let myself scream, not at someone, or I'd say to somebody, I'm really irritable right now, so you need to know this is not about you. So you might want to leave the room. I would do whatever I needed to. I'd go for long walks. I'd be in nature. I'd scream in nature. I would let myself go through the emotions so I could come around to where was a healthy spot for me to go forward. And sometimes that would take me a long time to get there. Grief is significant. We don't talk about it in our society very much. Now I will say to my siblings and my close friends, I'm okay if you need to grieve. If you want to talk about it, I'll let you know if I feel like I can handle it at the moment. If it gets too much for me, I'll let you know. If my own grief becomes too much, I'll probably excuse myself. That's where support groups are so essential, and therapists, because they're trained to do those things. And just because you try a therapist doesn't mean that's the right therapist for you, or just because you try a support group. But give it time. Give it a couple tries before you decide no. And sometimes I've gone into groups and left them for months and then gone back to them because that's where I was. So I think it's healthy and okay to be angry. And usually now when I get a diagnosis, I'm more mad because I don't want that to be the answer. And then I let myself kind of whine and moan and cry, and then I'm okay with it. But I don't think if I'd given myself that chance to be angry, really angry and mad, I would get through it. I think I would just shove it under and it would blow up in places I didn't need it or want it to. And that's taken me a while and a lot of support from people who didn't always know they were giving me the support. So I think it's really important to feel all emotions. And hope is eternal. Even when it feels, it's okay not to believe in hope and then to come back to it and say, okay, I believe in hope again. Or I don't believe in miracles, and to come back to it and say, okay, I believe in miracles. Or I don't believe in love, and to come back to it and say, okay, I believe in love. it's really important that you really let yourself, all of us, let ourselves feel those things.